Hi everybody, welcome to today's video. For anybody that has got a community staff nurse interview coming up, Emily Ashwell has kindly offered to give you lots of tips today to help you prepare for your interview. And Emily has just started a new role as an advanced community practitioner. So congratulations, Emily.
Thank you.
And Emily was a community case manager before that, and she's recently completed a district nurse course. And if you're interested in careers, different careers in the community, Emily talks about that in a video that's on my YouTube channel, Community Careers. And she talks about her career development to get to where she is, which is very inspiring. And she talks about other roles as well. So Emily's going to give us some advice on what employers are looking for when you apply for your first community role, how to prepare for interview questions, and some top tips to help you prepare. So we hope you find this video useful, and thank you so much, Emily, for your time today.
No worries. Thank you for having me back.
So, first question, what are employers looking for when you apply for a community staff nurse role? And I'm asked this question a lot. So what would you say to that?
So yeah, there's several things that employers are looking for when you apply for a community staff nurse role, such as with all nursing interviews, do you come across as empathetic, non-judgmental person? Are you organised? Can you work well as part of a team? And have you made an effort to research and understand the role that you're applying for? So I'd make sure that you have a read through the job description and person specifications. And more specifically for community roles, I'd say, can you demonstrate that you are able to work as an autonomous practitioner? So completing your visits independently, but also having the awareness of how and when to seek appropriate support.
Lovely. And also, would you say that interviews, one thing I am asked as well is interviews expect you to be quite nervous because you might not have had an interview for a little while, especially if you've just done your degree. And so I get asked that a lot. So employers, so do you want to sort of say something about that? That if you are nervous, don't worry, because everybody is, we expect that.
Yeah, interviews expect you to be nervous, so don't worry about stumbling over words or anything. Just relax and be yourself. Because interviewing is a two-way process. So we're not just picking you, you're picking, is this the trust and the team that you want to work for? Um, so yeah, keep that in mind. Then it's more of a balanced conversation. And make sure you ask questions at the end as well about what's important to you. So it is a two-way thing. So don't worry about being nervous.
Yeah. And another question I'm often asked, so I've got all of these from my YouTube viewers. Lots of students are told to apply for a hospital role first before community. I know that you worked in a hospital trust for a very short period because you did your degree during COVID. And I think it was, did you say 6 months you worked in a hospital? But that
As a
was,
pre-reg
yeah.
nurse, yeah.
Yeah. But what do you say to students that are told to apply for a hospital role first? What would you say to that?
I would say you don't have to have worked in a hospital before coming into the community, as we will work with you to make sure you feel well supported and developing your new role, because they're so different. We'll give you all the appropriate education, initial supernumerary status, as well as joint visits throughout your career to keep up your confidence in various clinical skills you might not do as often. I personally chose to spend 6 months in the hospital because as a pre-reg nurse in the COVID pandemic, I wanted to feel more immediately surrounded by support networks before moving into the community once I completed my training and felt a bit more confident. So it's up to you as an individual, but definitely if you want to come out, just go for it.
And that's really reassuring, Emily, because I think that's the main reason people say go work in the hospital is because they think they're going to develop all these skills. But what you're saying is that preceptorship support and skill development, professional development is there in the community. Would you
Yeah.
say? Yeah. Yeah.
Yeah, and it's a variety of different skills. So like if you go onto a specialist ward, you have the specialist skills for that. So we have our own unique set, so it's definitely worth coming out.
Brilliant. And when also, I was going to ask about informal visits. So if you weren't quite sure, because I know lots of the viewers often are students or trainee nursing associates, and would it be beneficial to do an informal visit, even if they've had a community placement maybe, but to have an actual informal visit, would you say?
Yeah, it's worth reaching out and talking with your local providers as a student, as within a trust. Because I've had people within the trust come and do like a bank shift or two with us, so they can see what it's like before applying for the role. Then, so yeah, reach
Oh.
out, make contact. We're happy to have conversations with people who are interested to get them get them to come join us.
Yeah, I think that's a really helpful advice as well, because lots of students do bank shifts, and you might be applying for a staff nurse post as an experienced nurse as well, but
Yeah.
you've only worked in hospitals, and doing some bank shifts or doing an informal visit is helpful, some shadowing shifts. So another question I was asked is, when preparing for a community staff nurse role, what policies, standards, or guidance should you read beforehand? You know, if I'm sort of supporting people going for hospital posts, there's certain standards guidance that I would recommend. So what would you recommend for somebody preparing for a community staff nurse role?
So like I mentioned earlier, I begin with the job description and person specification for the roles you're applying for to identify key areas that they're interested in for that trust. So in district nursing, good starting points for knowledge are like your basic A to E assessment, which can be applied to any scenario. And also an understanding of the things that we come across quite often. So like diabetes care, pressure ulcer categorization and management. So you can find lots of information and guidelines for these areas on the NHS website, National Institute of Healthcare and Excellent website, nice guidelines, and even major charity websites as well.
Brilliant. And what about medicine management? Because we often say medicine management, or do you think that that wouldn't,
Yeah,
you
that's
might be able
also,
to, so for any sort of policies, guidelines like that would be,
yeah, we'd also go through that with you, so all the common ones that you're going to come across.
yeah, yeah,
So yeah, we'll do that with you as well.
yeah,
Other online resources you might want to look at are like the individual trusts website. So looking at their like values and goals to sort of familiarize yourself with. The QNI Queen's Nursing Institute website and the King's Fund also have a variety of resources which are
yeah,
worth having a look at,
yeah,
um, as well as like the basic 6 Cs of nursing. So yeah.
yeah. Yeah. Brilliant. And I think there's some new 7Ps coming out as well, if I
Yeah.
remember rightly, that they say look out for that. So at the moment it's 6Cs, but there may be something else from that comes out. So any other background research you think, anything else that and I've got down for when we look at supporting people going for band fives in hospitals, revising some key terms. So you might be asked about, we do value-based interviews sometimes, you might be asked about key terms such as quality or compassionate care or teamwork, or diversity, and just knowing that if you're asked a question about somebody that you've cared for, an example of compassionate care or an example of quality care, that you've got an example there. So do you ever do VBI interviews, value-based interviews, or maybe ask about and some care that they've delivered? Would they be sort of key terms that you might ask about?
Yeah, absolutely. For situations like that, scenario-based questions, I would always recommend thinking about a few recent scenarios that you've occurred in work or placement that you're really proud of, and reflect on why you're proud of this, what was done well, for example. So when you're asked these more generic questions, you're easily able to draw from these scenarios and apply your examples to the questions being asked.
Yeah, that's really good tip. So the sort of key areas might be quality care, compassionate care, team working's another one that I know lots of employers ask. And what types of scenarios? You talked about scenarios, and that is something that you might get in an interview. Something linked to a drug medicine administration, or something to do with it, you know, we'd look at potentially in hospitals, or teamwork or compassion. But or have you got any sort of scenario type questions that that might come up, or areas for scenario questions? Because obviously you don't want to give
Yeah.
specific questions.
So examples of topics you might want to you might be asked about in an interview scenario question include what would you do if you like attended a routine planned visit such as wound care or insulin administration and find that the patient has unexpectedly deteriorated. So how would you manage if the patient declined or if they declined essential care such as declining their insulin or declining pressure area check? So how you'd respond to these situations and trying to think holistically about what factors might have led to this situation occurring to guide how it's best to manage safely and effectively with their best interests in that mind.
And there's sort of similar questions to other band 5 roles, actually. Similar, you
Yeah.
know, what do you do if a patient refuses care? And it's thinking about the Mental Health Act and mental capacity assessment that we do every time we, you know, ask for consent, you know, if you're interacting with patients. So so that's really helpful stuff there. And always, I suppose, if you're unsure of an answer, one of the key tips I give is to escalate. You'd
Hmm.
ask someone, because mainly interviewers want to know that you're safe, so that if you're not sure about an answer, that you would ask and find out. So I would always defer to that. If you, would you say, I don't know if you'd say that's similar.
Absolutely, yeah. Communicating, escalating appropriately. So the more people you work with, the more information you can get and share. It demonstrates good team working as well.
Yeah, brilliant. And then there's going to be certain generic, broader questions. Tell me a bit about your degree, or tell me a bit about what you're doing currently, how to manage stress at work, and or give me an example where you provided compassionate care. And sometimes those questions can't be planned for, but some can. And so I've written down to think about maybe some of these questions, why you've applied for the role, and if you've been on an informal visit, or if you really enjoyed your community placements, it's to think about, you know, really think about why you want that role specifically. And I think you've given some really good tips about looking at the employer website, um, and you know, talking to those that are offering the job. Have you got any other tips for sort of generic, broader questions, maybe?
Yeah, thinking about, well, obviously what I've said earlier about the recent scenarios, drawing upon already reflecting on what you think you've done well in the past.
Yeah.
For me as well, before coming into the community, I had no experience, but I knew about the things that they did. So I liked that they took place at home and you had longer term relationships, developing a therapeutic bond, to get the best outcome. So just knowing about stuff like that, and if that's something you're passionate about, you can bring that up in the interview as well. We also do a lot of wound care and like palliative support. So if that's something you're interested in on the wards, you can easily draw that in across to the community. So stuff like that. I'd also advise being prepared to take like notes throughout your interview. So if you're worried that you're not going to address all the points of the question, you can just jot stuff down to make sure you come back to it if you'd like. And don't be afraid to ask the interviewer if you think you've missed something, because we'll go back over it for you.
So when you say bring notes in, you don't mean bring loads of answers in. You mean that you can
No,
write down your answers. Absolutely. If
yeah,
that helps you, um, you know, think about the question. You might find it easier writing. Absolutely. But you do have to be careful about bringing loads of notes for
yeah,
answers.
no, like a
Um,
piece of
yeah,
paper and a pen and just jot down
yeah,
what they've
yeah,
asked. Yeah.
yeah. I think it's a really good tip if that's, you know, easier for you. Definitely. So anything else? Any other tips that might help?
Yeah, just relax. Like I said earlier, it's a two-way interview process. So think what's important to you, any questions you might have, and can talk it through with them as well. So yeah, be
Brilliant.
yourself.
Oh, thank you so much, Emily. I mean, I have got a video on questions to ask at the end of interview, which is a very short video on my YouTube channel, and all the videos are free. And that links to, you know, might link to your future development, asking about preceptorship. So I think it's really important to ask a question or two, because you want to know that that place is right for you as well, don't you?
Exactly, yeah.
So you shouldn't be going anywhere that doesn't offer good preceptorship or a preceptorship program either. So thank you very much for your time. So we hope that those tips help, and do put any questions in the comments in YouTube. And don't forget to like if you found Emily's tips today helpful as well. So thank you very much, Emily, for your time.
No worries. I hope that helps.